Thank you for tuning in to the Excellent Exchange podcast. I'm your host, Sharon Hulse, president of ERG Executive Search, a nationwide executive search firm based here in Appleton, Wisconsin. Today's guest is a seasoned healthcare leader with a distinguished career in blood banking that spans over 35 years. As the president and CEO of the Community Blood Center and Midwest Blood Centers, his leadership, vision, and passion have led to remarkable growth and expansion. Recognized as a 2023 Wisconsin Titan 100, his unwavering dedication to ensuring patients have access to life-saving blood supplies has transformed countless lives. Not only is he a key member of the community, but his influence extends to many nationwide organizations as he now serves as the chair of the AABB Task Force on Domestic Disasters and Acts of Terrorism. His deep commitment to making a difference embodies the essence of impactful leadership. I am thrilled to welcome to the Excellence Exchange the president and CEO of the Community Blood Center, John Hagins. Hi, John.
Hi, Sharon. Well, thank you so much for that introduction. That was so kind.
Well, it's your career is a outstanding testament. And you and I know each other. Obviously, we live in the same community. But one of the things that I love so much is the Community Blood Center. And I want to talk a little bit today, and we will touch on the business of blood banking because it's so different than, obviously, I think, as a general rule, the population, thinks about when they think about blood banking. So let's start with your journey. You were in Atlantic City, so that was a while ago. And then you worked through your way American Red Cross, and then ultimately to become a very significant driving force within blood banking. So talk to me about your current role, Community Blood, and that journey to get to where you are today.
Yeah, that's great. So started out, as you mentioned, in Atlantic City, New Jersey. That's where I was born and raised, and had the normal, I think, beach life type of thing, being a couple of blocks off the beach as growing up. And my first job, as you know, and many others may know, was on the boardwalk in Atlantic City at 14, and stocked shelves at Planters Peanuts during in the morning, and in the afternoon, I put on the Planters Peanut shell and went out and had pictures taken with kids across from the Steel Pier in Atlantic City. So it was a little bit of a showmanship start to my career, but something that I found very invaluable. So that was the beginnings, and there was no indication there that blood banking would be in my future at all. And went to college locally. And my senior year in college, there was a job at the American Red Cross to pack blood to go to hospitals. And I thought, wow, this is a good opportunity for me. I can finish my senior year. It was good work. It was good pay. And then I can, get that air quotes going, find a real job. The real job ended up finding me because I started with the Red Cross when I was 21 years old. And I've been in blood banking the entire 36 years since then. And sometimes you say you find your career, and other times the career finds you. And in my case, the career found me. I worked 27 years for the Red Cross, 22 of them in Philadelphia, and became part of that community. 5 years before coming to Appleton, I was at a blood center in Johnstown, Pennsylvania, which is right outside of Pittsburgh. But that included 100 counties in 5 different states and a wide geography. And I remember distinctly, I was driving from a meeting in Lexington, Kentucky, to go to another meeting in Morgantown, West Virginia the next day. And I got a call about 3 p.m. From someone saying, would you be interested in talking about a position in Appleton, Wisconsin with the Community Blood Center? And I said, first of all, I have all kinds of time right now. I've got about 4 hours in the car. So if you've got time, I've got time. And the second was, tell me about Appleton, Wisconsin. I had never heard I had a lot of detail about Appleton, had a good reputation of the Community Blood Center, but didn't know a lot about the community. So that started my journey, and it'll be about 10 years in November.
That's amazing. And obviously very grateful. You have done, your predecessor did great work, and you've even taken it further than what we thought possible as far as the Community Blood Center would be.
When I came in, the Community Blood Center, some of the leaders here said it was the best kept secret in the area, and we set out 10 years ago to change that perspective. And we're an over 60-year organization. And in those 60 years, I'm the fourth president and CEO of the organization. So it's been very stable, long-term folks. The first CEO was 25 years. The second was 25 years. My predecessor was in for about 4 before he decided to retire. And now it's me at about 10. So a lot of stability, but a lot of great opportunity.
Yeah, no, it's just such a different business than I ever anticipated it would be when we had worked with Rick. So, one of the things that as CEO that I read, you stated your goal was to ensure patients relying on blood transfusion have access to that blood. Share for our listeners the insights on how does your team ensure that that happens every day, and what are some of the challenges that you face in order to hit that goal?
Yeah, so the number one challenge is always supply. And that's where we spend most of our time day in and day out to make sure that there's enough blood donors available to meet the needs. Because in the end, it all starts with one human giving the gift of life to another, and so that's what drives our entire process. Some people may think, well, we collect blood and then we send it off to hospitals and it gets transfused, and there's a lot more that goes on to that. It goes into that. That may have been the way it was in the 50s and maybe 60s, but today's world, that unit of blood that's broken down into its different components: red cells, platelets, plasma. While our staff are manufacturing transfusion components, the test tubes that come along with a blood donation are going to our testing lab. We've got a state-of-the-art testing lab here in Appleton, where we test every blood donation to make sure it's absolutely safe for the patient that's going to receive it. Once all those things happen and come together, and remarkably, that happens within 24 to 36 hours after a donation, blood products are available to go to hospitals. And we're really proud of the fact that over the last 10 years, we've grown from serving 18 local hospitals to well over 40 now. And we're meeting the transfusion needs in communities all across Wisconsin, the UP, and even some far-reaching hospitals in Boston, in Morgantown, West Virginia, in Pennsylvania, and in Texas. So the impact that we have here, we like to say that we're locally focused, but we're nationally connected, and we make sure that every blood donation is used to its fullest extent.
That was the thing that was so fascinating to me when we worked with the board on a search for your predecessor. It's such a different business. I mean, I probably had the same impression as most of our listeners, and that is the bloodmobile. So you think you go in, you donate blood, it goes to one of the 2 local hospitals, and then that's the end of it. And you have no idea the testing and the state of the art facilities that you have here, and all of those things that really make blood banking big business. The exporting and importing of blood and all of those different things. So, talk to us about the business of blood banking. You grew up in this industry. I believe, by the way, what you said, careers, typically people, unless you're going to be a doctor or a lawyer, you don't choose that career. It chooses you, and you grow up in it. Were you surprised early on at kind of the big business that making sure people had what they needed in blood banking? Were you surprised by how big a business that is?
I was. I mean, my interaction before joining the Red Cross at the time, my interaction was donating blood in high school, right? And you do it to get out of class, you do it for all the fun reasons. So I was in the same spot that you were. What amazed me was the amount of complicated processes that go into making sure that the blood that's being collected is safe for patients to be transfused. And at the heart of everything that we do, it's connecting the blood donor to the patient. But that level of connection can be fairly complicated between the testing pieces. And here in Appleton, we've invested pretty heavily in the last 5 years in upgrading and advancing our testing opportunities. Just the last year, we've added a molecular testing lab that took our level of capabilities and capacity to even greater heights. And I'm really proud of the things we've been able to do here, and the jobs and and the science that we've been able to bring into the community. But in a general sense, blood is a perishable commodity, and we have to make best use of it. Our number one value here is stewardship, to make sure that we take care of the precious gift that we're given. And that means that within 24 to 36 hours, most of the blood products that are donated are going out to our local hospitals. Within 2 to 3 weeks, if they haven't been used from that hospital, it's our job to cycle them back out and then make sure that they can go to a patient that needs it anywhere in the U.S. And that's the way that our blood banking model works. And the donors in Wisconsin are so generous, and that we take care of our local needs first, but we also have the capability and capacity to be able to spread that good feeling and charitable giving from a blood donation perspective to so many other communities around the U.S. It provides us with an opportunity to serve all of our hospitals, whether they're trauma centers or whether they're rural hospitals, with the blood products they need when they need them, and then also make sure that we're good stewards of the gift that we've been entrusted with.
So I was thinking about our visit, and one of the things I was thinking about with your long career is you've been through a lot of the same challenges that we've experienced, but you've been through the AIDS epidemic, you've been through COVID. How did those, I mean, those are significant events that impact your business probably more than any business. So talk to us about that, and how did you have to pivot during those times to make sure that, still you're serving and you have stewardship for the people that need your services?
Sure. It started out. I started in 1987, so it was probably the height of the HIV epidemic, and with blood being a possible pathway for transmission, we were at the forefront of trying to make sure that blood products and blood transfusions were as safe as possible. And that's been a long road and a long transition. And most of that was driven by science and being able to develop tests that were more sensitive and continue to be more sensitive as we go along. And that was a slower evolution that focused completely on patient safety from a transmissible disease perspective. COVID was something completely different. COVID was it changed our business remarkably. In a typical model we had pre-COVID, we would work with community members that wanted to sponsor blood drives, and they would recruit their friends and their coworkers to come to a blood drive and donate blood. When everything shut down for COVID, that model virtually disappeared. And we had to figure out very quickly, how do we meet the needs of the community for blood products in a way that our model no longer functioned the way it did before. So we had to basically move from a business to business model to a business to consumer model, B2B to B2C model. And that had to be done pretty much within just a few weeks. And so we rallied the troops, great leadership team here at the Community Blood Center. And everyone was all in to figure out how we could best do this. And we went back old school, and we did a lot of direct mail and sent it through U.S. mail. But we also used a lot of the technologies that were available to us, whether it was texting, email, notifications, just to get the word out that the normal donation channels weren't available. But we had our fixed site locations. And when everybody was talking about what was essential, we were very fortunate that we got a lot of good messaging from the Surgeon General and others that blood donation is still essential. And it was one of those places that, still go out, still donate blood, and still support the community in that way. And we grew 5% during that first year of COVID in our donations. And it was a great community feel to it. There was a real coming together that we can support this. And then it was a real quick flex from a business perspective. How do we meet donors, potential donors, where they are? And it was hectic. I'll say that. And I think that now that we're post-COVID, we're trying to learn a new world. And what that new business model is with hybrid work, or manufacturing facilities that are backed up still with demand, and maybe they can't afford the same commitment of time for their employees to take time to donate blood. And so how can we continue to evolve our connections to the community to meet, again, potential donors where they are. So it has been certainly has been a journey, and we continue to learn every day. And I think we continue to experiment with the best way to connect people to each other. And sometimes it's easier, and sometimes it's very difficult.
And that's the thing that I admire so much about you is you truly are, in my opinion, that visionary leader who's always looking at the landscape and saying, okay, so we need to be on the leading edge. We need to be on the bleeding edge of what's happening within our workplace, within the economy, all of that, to still make sure to serve those people who need us the most, right? Those patients that desperately need the product that you have, which is blood. So thinking about your early career and today as CEO, what are some of the things? I mean, we've got a lot of people who listen to our podcast who are, in that mid-career, right? They're not CEOs yet, but they aspire to be a leader. What are some of the things that sort of help to, set the stage for you to ultimately be able to be the kind of leader that you are today?
Oh, that's a great question. And in thinking about that, I think it comes down to two things. I was always grateful that I reported to leaders that allowed me to be entrepreneurial. So, the idea of being able to look forward and to test new ideas and to do things within the risk structure that everybody finds tolerable. But I was given the opportunity throughout my career to stretch to that next role. And I'm very grateful for some of those leaders. And they trusted me, and they had faith that what I was doing was taking us down the correct path. And the second thing I think from a leader is to begin to develop the support system around you and the good people around you that can fill in for some of your weaknesses. I'll firmly admit patience is one of my weaknesses. Go.
I think most entrepreneurs, that's a weakness.
Yeah, right, exactly. But you need a team that can also kind of check the boxes as you're going along and make sure that your ducks are in a row. And I think building the right team and having the right support above and below you in an organization is important. And those are the big drivers, because I think as leaders, we almost can do anything. We can, if we see it, we can almost create it. And it's trying to pick the right things that would make the biggest impact for your mission. And in our case, it's making sure that blood transfusions are available, or even, as we're looking now and looking to the future, cellular therapies, the use of stem cells, the use of autologous donations, a patient that's going through cancer, donating their own cells so they can be treated and infused back. So they're very targeted cancer treatments. Those types of things are the exciting things that are happening within the realm of transfusion medicine, where we need to point and go forward. But we also need to do that in a way that we're trying to see how it fits into the community we're trying to serve. And again, I said before, we're kind of locally focused, nationally connected. So having those conversations with our local healthcare leaders to find out where they are in the spectrum of care for patients, and how can we best get ahead of that so that we can meet their needs when they need it. But going back to your original question from a leadership perspective, be entrepreneurial. Be inquisitive. Read a lot. Develop your team and have those conversations within the team that sometimes can be uncomfortable. I like to use the term productive conflict. When you can get a group of people together and they're all really passionate and they have the right intent, they want to drive the organization forward, but there's multiple ideas. The conflict that comes before them, that friction that's generated, is what moves us forward. And it's not a bad thing. You can live in that area to where you really come together as a team and can figure out, what is our best path forward.
You have
some of those basic
team.
Elements of team building. Yeah.
How big is your team, John?
My leadership team is about seven people. Overall, the organization is just about 200 employees right now. So it's growing as we've been growing, and I think the structure within the team has been evolving. But I'll say this: I'm a big fan of Pat Lencioni and the 5 dysfunctions of a team, and to me, that that bottom building block there of trust is what starts everything. You spend some time developing trust within the team, and then you can begin building things, building elements of conflict and conflict resolution up to the top level where you're looking at alignment and delivering on results. And that model has been one that I found very, very helpful over the course of the last 10 or 15 years in working with the team, only because it hits the right spot in saying that it all begins with trust, and beginning to work together means that you can be vulnerable and you can put your ideas out there, and everybody's coming from the same place of, we want the organization to do well, we want to fulfill our mission, we want to meet patient needs. And maybe it might be a little hubris, but we think that the way we do blood banking and the way that we meet patient needs and the model that we have are better than most. And we want that to grow. We want to be attached to more communities, involved in more communities, because we believe that that's the best way to serve patients.
Yeah, I think you're doing an amazing job. I mean, I live here, so I watch what you've done since taking over, and it's been nothing short of phenomenal. I am curious. So, one of the things that you've sort of handpicked individuals to be part of your leadership team, and it's been very thoughtful, I think, on who you're targeting to become part of your team. Do you have a leadership strategy, and are you choosing people that will challenge that strategy, or choosing people that can chase the hill? I mean, I'm curious because I think you've been probably more thoughtful than most that I've observed on really focusing on targeting specific individuals that I think most people would look at and say, why would he hire someone like that for that industry?
Yeah. So again, another great question. And you asked about whether or not I would choose someone because of the strategy and challenge the strategy, or to fit in with the strategy. And the answer to that is both. I've tried to build a team. One, they're energetic and smart and passionate about what they're doing, but they all bring something different to the table. I have a chief operating officer who's been in the industry almost as long as I have, and she's a wonderful resource and a wonderful leader. And operationally, I haven't found anybody better. And she keeps the trains, moving on time, and provides the leadership to the staff. I have a tough time finding enough adjectives to explain how great it is to have her on the team. Flip to that, to someone we just brought in new as our HR leader and our human resources leader, and what I was looking for in an HR leader at the time was someone, as we're growing, how do we grow that middle level of managers within our organization? And the focus wasn't necessarily on the nuts and bolts of human resources anymore, but it was on staff development and leadership development. And fortunately found someone that was interested in our mission and had a passion about our mission, and also was ready to take that next jump and really wanted to embrace the staff development piece and really help us develop that next level of leader. So we're always in a transition period as you're growing, and you need different things at different times. And at this particular time, we needed a senior leader that could help us explore the best ways to develop our internal leadership and bring leaders in and help them grow in their careers. And we moved from an individual contributor phase of, someone can make a big impact in a smaller organization just on their own, to needing some structure and needing leadership to handle our growth and handle the complexities that come along with it. So my choice in building a team really is to fit the individual needs at the time, and then also recognize where the strengths and weaknesses are of those team members. You want to build a well-rounded team that can flex, and certain folks can come to the forefront at different times and take the reins. And again, I've been very fortunate that good people have been attracted to the community blood center and have wanted to contribute to our mission. And that group, continues to evolve, it continues to grow, but it does make work a lot of fun. You probably know this: when you have a great team, it makes it a lot of fun to come to work.
what you didn't mention that I think is worth mentioning for our listeners is you did not hire based on resume. Your HR person came from manufacturing. So the thing that's so fabulous about that is you hired for the person. Like you said, you hired for the individual needs and what the organization. You didn't hire, because people tend to hire, well, I want a person who comes from our industry and has that line of sight. And that's really where people stop. And if the resume doesn't look perfect, they don't hire. And the companies that we see grow the fastest are people who do exactly what you do. And that is you hire for who they are in their heart, how they meet the mission, and how they can help your organization to grow future leaders. And you've done that incredibly well. And not all organizations have figured out yet that if you hire for the person and you don't just hire off resume, you're going to grow probably faster. So kudos to you for doing that.
Thank you. I think that's a great point. And out of the 7 leaders, 2 would have probably grown up in the industry or had specific training. Our chief medical officer and our chief operating officer. The other leaders, we selected them for their talent, for their passion, for their intelligence, for their leadership qualities, and it's really helped. We can teach this business. It may take a while, but we can teach this business to people. But the intangibles that come along with the person are so key to being able to be successful.
Yeah, and I have no doubt that's one of the many reasons why you're truly an innovative leader, not just locally but nationally. So let's talk about all these industry associations you're involved in, the local stuff. You got to talk to me about balance, because I look at your list of professional organizations you're involved in and the stuff you're doing locally, and I think, all right, how in the world does he maintain any balance? And yet, we're Facebook friends, and I see you and Leah just off having a great time, and somehow you figured out how to strike that balance. So you have to tell me what the secret is.
Well, I think that the secret is I don't know that I know how to say no with some of the opportunities that come up, and I say that cavalierly, but really it's more purposeful. I always look at it. I never know where the next opportunity is or the next connection that's going to lead to something fabulous. And if you guard your time so closely and you're too worried about balance, you miss some great opportunities and, more importantly, some great people. And that's locally and nationally and within your own family. We try to maintain that balance and try to maintain certain times where we're it's our time, but at the same time, the richness and the depth that the connections, whether it's locally in the community through some of the activities we're involved in and I'm involved in, or it's nationally through some of the organizations, there are some great people out there that I call colleagues and really are friends, that just enrich your life so much. So we do find the time. I've got two daughters, one that's just getting ready to start college in a little bit, and the other one that's just starting 8th grade. So we've got those family type of activities that are going on, and spending time and carving out time for Leah and I to both be able to enjoy each other and our family, but at the same time also be able to explore things professionally and socially that are of interest. Again, if you say yes, you don't know where it's going to lead. And some of those paths have been pretty remarkable.
I've often told my daughter, if they're asking for volunteers and you don't know how to do it, raise your hand anyway, because you're going to learn something new. Yep. And it's a great way to get noticed within your career. So I know you place a high value on engagement. That's everything I read about John. You place high value. So how do you think that helps emerging leaders? Because obviously you have benefited deeply from being involved, especially in the industry related organizations. So from an emerging leader perspective, how would you suggest someone start to get more involved, whether it's industry related or even within the community? How would you recommend an emerging leader start to get involved?
I think you touched a little bit on it with your advice to your daughter, but it's step forward when there's an opportunity. So many times there's a lack of confidence that you don't know all the answers, and don't know all the right answers, and at what level can you contribute? Well, contribute at the level that you can, step forward, and then learn. And one of the most interesting aspects of being involved in boards and being involved in the community and even industry organizations is how much you learn about other businesses and other business models and what makes that organization tick. That's really fascinating. But you have to take that step forward, even if you're not quite sure you know everything, because you're never going to know everything. But if you take that step forward, you're going to learn a lot and you're going to be able to contribute a lot. And I think that's what I would give my daughters as advice is the same exact thing. Engaged, take the step forward, be the first to reach out and say, yes, I'll do it, or yes, I'll be involved in doing it, or yes, I'll support you in doing it, and be a sponge and bring all that knowledge and all that activity that you're going to be involved in, bring that all in internally and figure out how you can process that going forward. But the biggest part is that, yes, it's stepping forward and saying, sure, I'll do that. Sure, and you know what? In some cases, I'll figure it out as it goes along. And in other cases, I've got this and I know. And what's pretty amazing is that the linkages between many different variety of activities, there's some fundamental pieces. I've been involved in the local corporate board of the YMCA for a number of years now. And that non-for-profit entity certainly rolls through from my business experience. It's a different business. The health and welfare of our community is different than providing blood products to the community. But there's still some key fundamental things about engaging people in your mission and having a passion about serving the community that rolls through. And those are the building blocks. And if you could step forward and say, yeah, I'm interested in doing that and learning and then contributing from your own perspective. But it's getting them. It's saying yes. It's getting involved in the first place that really is the catalyst to what the future holds.
I agree. So I have to ask this because everybody, I'm sure in the intro, went, "Oh my gosh, what does that mean?" Because I would probably be scared to death of this. You chair the AABB Interorganizational Task Force on Domestic Disasters and Acts of Terrorism. You have to tell me about that because when I read that, I was like, okay, in this world, I'd be terrified to do that. So talk to me about what that organization does.
So the organization is part of and coordinated by the Association for the Advancement of Blood and Biotherapies. That's AABB. And the task force was formed right after 9/11. And what happened during the terrorist attacks was there was a community outpouring of what can we do and how can we support our communities that were impacted. And part of that was there were a lot of people that donated blood. And for about 6 weeks after 9/11, there continued to be an outpouring of people that wanted to do something and wanted to contribute something. And donating blood was one of those natural things that you could come together and do. But there's been reports and about the groundswell of support, and there was more blood products donated than what was needed, and many of those expired after the 6 or 7 weeks. As I said before, it's a perishable product. So what we realized as an industry and as a nation is that we needed more concise messaging and coordination among the multiple entities so that we were able to call on the public when needed for blood donations, or if they weren't and we needed something that was more of a staggered approach, there would be that clearinghouse for that type of information. And that's really what the task force has been doing in the 22 years since then. And I was honored a couple of years ago when they asked me to chair the task force, and it brings together military, it brings together governmental agencies, it brings together those that are part of the blood banking community, those that are part of the hospital associations, and provides a forum that when there is some type of disaster or some type of event that needs blood products, that we can come together, that we can coordinate and understand what the need is locally, what can be still supplied locally, and then what we need to bring in what resources we need to bring in from outside. And thankfully, most of this has not been to the scale of the terrorist attacks on 9/11. But there have been some major activities, hurricanes, for example,
Right.
when they go through Florida or through Louisiana, can wipe out full communities and can wipe out the infrastructure for a period of time for those entities that are collecting and distributing and providing blood products. And so our job as part of the task force is to identify what those needs are, and then use our resources and our network to provide into those communities that need the most. And sometimes it's gone beyond blood products. The task force was intimately involved in Louisiana during a hurricane in providing generators for the local blood center, because they were disconnected from their power and needed to continue. So there are a wide range of things that we seem to get involved in.
Well,
but in the end, it's to make sure that blood transfusions are available in those communities. And the amazing thing about our network, the Red Cross is the big player. 40% of the blood supplies it comes from the Red Cross. The other 60% comes from a network of about 50 different community blood centers. Some of them larger and some of them smaller than the community blood center. But that network and that lattice work of bringing those organizations together provide a great flexibility in times of need, because what's usually affecting one area of the country isn't affecting everywhere. And we can come together and bring those resources and provide them where they're best needed. And the task force provides that coordination.
that's amazing. I've often said people have no idea. Like when I travel and I tell people I'm from Wisconsin, they kind of look at me like, oh, or they don't even know where Wisconsin is. And I've often said we have some of the most amazing, amazing people in the state of Wisconsin, including John, who chairs this committee. I mean, seriously, that's really amazing. And, the work that you're doing, not just locally, but nationally, really is making a difference. So, no doubt, the reason why you became a Wisconsin Titan 100. So I have to ask you, what did winning? We were commenting on this earlier about we're not sure how we won. So you have to tell me, what did it mean for you professionally to win that award?
It was, personally, I mean, Sharon, right, Sharon. It was such a recognition that it was really humbling, I think is the best way to put it. Especially once I met the other Titans and the work that they're doing in so many different areas. And I did say, how did I get on this list? How did I, what is it? They're just amazing people, amazing stories, amazing backgrounds. And just to be included in that group is so remarkable for me, professionally and personally, and hearing their stories and getting to connect with people on a one-to-one basis. And they learn a little bit about blood center and blood banking. And I learn a lot about many, many different businesses and opportunities and not-for-profits that are all part of Titan 100. I think it's a great program. I think it's certainly great recognition. And there's a series of events that go along with it that bring us together on, some are professional development, some are just fun, and being able to relate on multiple levels with some of the most fantastic leaders I've ever met. It's been a great experience, and I'm so grateful. I was joking with you earlier. I think my application must have gotten connected to somebody else's, and it got passed right along. Because,
I don't think so. No, it's been great. So one last thing I want to make sure and ask about within our time is the Green Bay Packer Mentor Protege Program. I know you're involved in that. For people who don't know a lot about that program, I think people are real curious about it. Can you talk to that program? Because I know that you've been involved in that. So tell us a little bit about that.
Yeah. So here's another one of those opportunities where you say yes and you move forward. The Packers support a great program in Northeast Wisconsin, where they bring new entrepreneurs and new business owners together with those that have some business experience, and they do a great job of matching the expertise of a mentor with the needs of a protege, they call them. And you go through a year-long process where you work with them side by side and help them develop business plans, or to help them develop marketing plans, or execute against strategy, or just the everyday ins and outs of becoming a leader of an organization. Most of these are small business owners. Maybe most of them are first-time business owners, and they're looking for some guidance along the way of how they can begin to grow and really deepen their business acumen along with the products and services that they're offering to the community. So this is a great program that is part of a Packers outreach and supported. And there's a competitive process that goes along for both the proteges and for the mentors. And the important part there is getting the right match for the right people. And I've helped a business develop business plans and funding plans to grow an organizations. And it's been a lot of fun. And you get to meet such remarkable people that are entrepreneurs and have that spark and are really engaged in what they want to do, and they have a passion about it. And just to be able to help them a little bit move forward is really, really rewarding. And the Packers are such a great organization for sure doing the NFL and doing the football piece of it and such a tradition of winning, but also reaching out into the community and supporting many, many other opportunities. And in this case, it's for new entrepreneurs or growing entrepreneurs and having some support resources to it. So it's a fabulous program.
I was really excited to read that you are part of that program because obviously your leadership has been amazing. So we're getting close on time here. Any words of advice or key skills or something that you can share with listeners that are saying, I want my career to be as magnanimous and fabulous as John's has been? What advice would you give them?
I would give them the same advice I give our new hire class when I meet with them on day one. And that's, find your passion. When it's 5:30 in the morning and it's February in Wisconsin and it's dark and cold, to be honest,
Yes.
Knowing that at the blood center, I'm getting up and all of the nearly 200 staff that are part of the team are getting up every day to connect a blood donor to a patient. It helps you put your feet on the floor and get the engine started. And if you have that purpose, if you have that mission, if you have that feeling that what you're contributing to is certainly far greater than what you can do individually, it really does make the rest of the day a heck of a lot of fun. And when you're having fun, it unleashes an energy that's just boundless. And so what I really hope for the new hires coming into the organization and for anyone out there listening is that you find that passion in what you're doing so that it's not a job. It's not you're going to work, but this is what you're doing and you are firmly engaged. You're firmly leaning forward into the activity. It makes everything go so much smoother. It doesn't feel like work. It really does feel like you're doing something important. You're doing something that is moving the community forward, that you're providing a service for patients in my case. And this was the case of the career finding me and the mission finding me. And I've loved every minute of it. And what I wish for my daughters and for everyone is they find whatever it is that is their passion. You can see it in the proteges I talked about in the Packers program. They have a key element. One was a photographer and just loved sharing that idea of photography with her clients and the smiles it brought to their faces. Another was in a marketing agency and really wanted to help others, put their best foot forward, and they had a passion for that. And they found it. And I don't think that they thought that when they got up every morning, they were going to work. I think they thought that they were fulfilling, what they were put here to do.
It is 100% critical to figure out your why. And when people do that, I call it the aha moment. You can just see that the functionality of the day-to-day goes away, and it's replaced by this feeling of what I'm doing every day is making a difference, not only for myself and my family, but for other people as well. So I want to make sure people know how to connect to John and to the Community Blood Center. So can you share, how do people get in touch, whether they want more information from you or they want to be able to donate blood?
Yeah. So the easiest way to do any of this is to go to communityblood.org. It has the contact us pieces. It has the donate piece. It has more information than I could ever provide about the process of donating blood and what it takes to really save a life. Someone will take an hour out of their day. The blood donation process only takes about 5 minutes, but they can take an hour out of their day between the medical history screening and the juice and cookies at the end. But they can have an impact. Talked about breaking this down into three components that allows that one blood donation to have an impact on up to 3 patients. So if they want to contact me, you can contact me through the website. You can also go to Hagins at communityblood.org if there's something else that you want to ask. Always open to questions or ideas or anything else. But if you want to connect with the Blood Center, it's communityblood.org.
Well, John, thank you so much for doing this. I've known your story for a while, and I wanted to make sure that it was told and that people could hear from someone who is just, I admire and has done such amazing work in an industry that I think is somewhat, like you said, best kept secret. You've done a great job of making sure that the Community Blood Center in Appleton is no longer the best kept secret. So thank you again for being a guest, and thank you for all you do.
Thank you so much for the invitation, and it's great to be a Wisconsin Titan 100 with you.